we're very excited to have Jamie Sarno, who is the National Sales Director with Aetna. Before I turn it over to Aetna, to Jamie, I just want to let you guys know, I mean, it's always great to have someone who has actually been in your shoes before talk about these ancillary products. When he's done with his presentation, I'm going to show you some of the tools that we have available so you can actually go in and you can quote and enroll these your clients into this. But I often think that the ancillary side of things is something that's always left on the table, and we're starting to see more and more agents talk more about this, and because it's definitely coverage. These are holes that Medicare doesn't necessarily cover that this plan, or plans that Jamie's going to talk about will actually fill in some of those gaps in that. So if you have any questions throughout the presentation, just let us know. You can put it in the chat box. We'll be working that and getting your answers to your questions right away. So with that, Jamie, always a pleasure to have you do these presentations for us. So with that, I'll turn it over to you, Jamie.
Hey, thank you, Tim. That's very nice of you. Good morning, everyone. Great to be here, as always, with Cornerstone and all of you. Tim is exactly right. Of course he is, because more and more ancillary are being designed by all carriers right now because there's a need for it. I've always looked at it, Medicare on its own needs a Medicare supplement. A Medicare Advantage plan on its own needs a hospital indemnity. They just seem to go hand in hand. And you know this from clients that have used a Medicare Advantage plan, and when they owe some money, they're typically upset. And, I'm going to get into that here. I'm jumping ahead. But like all of you, I start out Monday with nothing up for the week. And my goal is to get something on Monday, and every day of that week, just sell and sell and sell. And it always works out because we're all out there working as hard as we can. But if you have more tools, and Tim's going to give you a whole lot more at the end of this, you're going to find the world's going to open up to you, and you're going to have so much retention out there, because what's better than one plan in a home is having two plans in a home, maybe three plans. And with all of these different ancillary avenues you can go down, they're out there. So if you've ever seen me present before, I like to talk a lot about Medicare and I show this clip a lot. And the reason is because I have been around selling to Medicare individuals since 1985, and I've seen a lot of changes. So currently there's 61 million beneficiaries. That's 18% of the U.S. population, and it's going to keep growing. So it's going to be 79 million by 2030, which again, used to sound like it was real far away, but it's not, as we all know. So what does this number mean other than it's getting bigger? It means the government is in big trouble, and they're having to find new ways to pay hospitals and doctors and nursing homes. And a lot of it is they're holding them to standards now, and they will penalize hospitals, they'll penalize doctors, nursing homes. That's a way for them to recoup money and make it last a little longer. So it's important to know what these changes are. And changes in Medicare will typically equal cuts and gaps in coverage. Somehow, some way, there's always a gap. If I go into a home that has TRICARE for life, a lot of people walk out of those homes and they go, oh, thank you for your service. You got everything you need. But you don't have nursing home care, assisted living. There's a lot of things you don't have. So there's always a gap to be filled. And Aetna tries to be the leader in filling the gaps for individuals out there, and always having a product for all of us agents that we can present. So latest changes in Medicare is this. what you're going to find is the Part A hospitalization faces insolvency by 2026. And you may have heard me say this before, but it was always in the future. They talk about Medicare going broke, Part A going broke. It was always 15 years into the future, 20 years in the future. It was never 4 years in the future. So a lot is going on. You're going to see major changes coming in these next few years that affect hospitals and nursing homes and those type of things. Also, I show this one a lot because this is something going on before our eyes right now. And it tells you, for years, the Centers for Medicare and Medicaid Services classified 1,740 surgeries and other services so risky for older adults that Medicare would pay for them only when they were admitted to a hospital as an inpatient. So now they're changing this. And what they're doing is, under the new rule, the agency's beginning to phase out that requirement. And on January 1st, 266 shoulder, spine, and other musculoskeletal surgeries were crossed off that, what's called that inpatient only list. So now what you're going to find is by 2030, this list includes, it's going to ramp up, and it's going to include brain, heart operations, and that is something big to know. And to let the people know, I always get into the house and I want to talk about something they don't know. I don't want to sound like the broken record of the agent that was there before me the day before and say the same things. I want to pique their interest. I want to let them know something that nobody else knows. And I would take something like this page here, I would master it, and I would let people know, do you know what's going to happen now and what's going to happen in 2023? And I'll get them so excited that they're going to know, wow, Medicare really is changing. I'm going to listen to more of what this person has to say, and I'm going to follow their guidance. Now, it's typically not that easy, but you know what I'm saying. They're hearing something they haven't heard before. And that always makes a big difference. So, Medicare Advantage. Not trying to dumb it down, but Medicare Advantage has gotten bigger and bigger and bigger because they keep adding all these great features. You know, the telehealth, the fitness, the dental, the eyes, the hearing. It's just, it really is good. It's something that Medicare, traditional Medicare, doesn't do. That is nice to have. So who would not want that, especially with a zero premium, right? That doesn't hurt at all. And as you can see, it has changed rapidly over the past 7, 8, 9 years. And its trajectory is up, 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 and it will keep going up because the government loves Medicare Advantage. Because guess what? Every person that takes a Medicare Advantage plan is off of traditional Medicare. And that really does save the government money. So, let me jump here. And one more graphic for you. And you can see, yes, this says 2020, but it does show the real percentages. So it's important. I love this map because you can look at any state you want and you can find out what is it in my state. And right now, 39% of the people on Medicare are on some type of Medicare Advantage plan, which is amazing to me. And there is another graphic. I like this just because you get to see who the pie is divvied up. You know, Humana, United Health, CVS, which is Aetna, you get your Blue Cross, and so forth. But I think it's interesting to see what's out there because it depends. You all know the areas you run in, what players are there, what carriers are there, what the co-pays are. You know it. You know what you're going to run up against from house to house. When you get into other states, it changes. And that's why I threw this up here, and you'll see. And again, this is the part I was talking about. I'm not trying to dumb it down, but this is really what it is. Cost sharing really is the concept of sharing medical costs, some of which you pay out of pocket, some of which the health insurance company pays. And that's really what a Medicare Advantage plan is designed to do. It is cost sharing. And there's nothing wrong with talking about cost sharing with an individual that has a Medicare Advantage plan. I promise you, they don't really remember they have copays, big copays, until they get sick. They know what the little ones are for their drugs or the doctor or a specialist, but they're not really thinking about the big ticket items. And that's our job, is to explain that to them. So this is the example. You know, if you get a bill for $706 and you're on a Medicare Advantage plan, I've had this woman, not this real woman, I've had a woman like this call me before and go, Jamie, why? You said I had everything I need. What? They're saying I owe $706.49. And I was like, Ms. Jones, remember, it's the cost sharing. We talked about that. You got the zero premium plan. You don't pay a premium, but you kind of pay as you go. If you get sick, you pay. If you don't get sick, you pay nothing. And they begrudgingly say, okay, you're right. I do remember you saying that. But in her eyes, and when I tell her that's the copay, she looks at it this way. She looks at it as, you know what, he did tell me that, but I don't like paying that money. I feel like the company let me down, my agent let me down. The trust is broken. And it's unfortunate that they feel that way, because you, the agent, myself, we did everything CMS compliant. We told them everything they were going to need to. I treated her like she was my mother, and I wanted her to know everything. And she loved me. She gave me vegetables out of her garden. That, you know, that happens in the summertime. She loved me. As soon as they pay the money, they're not loving you anymore. And they need someone to blame, and it's typically going to be us, the agent. So I think it's very important to make sure that they're not going to jump off of your plan and jump onto another one, because they really don't understand that they're jumping back into a different, they're going to change the agent, change the carrier, but it's basically the same coverage, right? They're in the same spot. The difference is the second agent is probably going to do the right thing and offer a hospital indemnity plan. And it's important to know this. The scope of appointment is there so you can discuss these things. Supplemental health products, just get them to do that. And supplemental health products, sometimes used to defray co-pays, co-insurance. These plans are not affiliated or connected with Medicare. That's all you have to do. If you're at the point of sale, if your reason for being in the home is because you were there on a Medicare Advantage lead, they wanted to see you for Medicare Advantage, then you need to follow these guidelines and get the scope of appointment. But did you know, if you are not there, I forgot I had this in there, sorry. What are the health-related plans? And this tells you Medicare supplements, hospital indemnity, long-term care, dental insurance, vision, policies. So that just gives you more of a definition of what these health-related plans are, which covers everything we're talking about, right? But what I wanted to say is this. It's important to know that if you're not in that home because of Medicare Advantage, you didn't get into the home because of Medicare Advantage, you're there, maybe you're on a lead for something else, you're allowed to talk about anything you want to talk about. It says, do I need to have prospects complete the SOA form to discuss Medicare supplement plans? It's not required for prospects to complete a scope of appointment form if they only want to talk about Medicare supplement plans or other health-related lines of business. So many agents, they're trying to do the right thing and follow the CMS guidelines, but remember, the CMS guidelines only apply when you are seeing someone for Medicare Advantage. you're allowed, you could go, and not that you want to do this, but you could go door to door and knock on doors and say, hey, I want to talk to you about hospital indemnity or other plans. You're allowed to do that as long as your reason for being there is not Medicare Advantage. So just some tips there, because I know a lot of agents get confused on what they can and cannot do being CMS compliant. So really quickly, I'm going to flash through these. You all know these, and yes, we're getting to the hospital indemnity, but I like just showing the things that are around there, because zero premium is always going to be the most popular, and it's always going to come with that cost sharing, right? And it's different all over the place. There's $390 per day for 5 days, and there's a reason I want you to see all of these. And even though they change year to year, Humana, nothing wrong with Humana, zero premium, inpatient hospital, and you'll see the 320 days 1 through 5, total out of pocket $1,600 if they stay that long. And again, well care, there's, like I said, there's a reason. Tier 1 and Tier 2, $200 a day for 5 days, $490 for 4 days. And, you know, you can go the other side of the United States and you're going to find it might be $695 a day for 3 days. It just depends on the state. And here is a big one. Cancer cost, Part B drugs, chemotherapy, 20%. That's a big number, $3,600 out of pocket. And don't forget this. You know, unlike a Medicare supplement cannot change its benefits, right? It has to stay the same. The company is not allowed to change one hair on that policy. They cannot change it. Every year, Medicare Advantage plans change. There's an annual notice of change letter that comes out, and it changes copays, deductibles, benefits. It might add benefits, take benefits away. So it's important to keep up with those changes. And what I'm going to use is the Aetna plan to be my template, okay? This HMO, and you're going to see the zero premium. I'm going to fill the gaps in this is what I'm going to do. That's why I'm using this one. So zero premium, got a maximum out of pocket of $6,500. And look, it's only $250 a day. Look how long though, 8 days. And also a total of $2,000. You also have the skilled care, which was $184 then, now it's $194, I believe. And day 21 through 100. So just remember this. When a person goes into a nursing home, there really are 3 types of care in every nursing home. There's skilled care, there's intermediate care, and there's custodial care. Most people in a nursing home today are under custodial care. It's the most used. That's more like personal care. They just live there, help with medication, bathing, that type of thing. Intermediate care is the second most used. That's for someone that has very hard time getting around. They may have had a massive stroke. They have a lot of therapy going on. It's going to be a long therapy journey for them and hopefully getting better and moving into custodial. Skilled care, believe it or not, is the least used. Think of skilled care as like intensive care in the hospital. You're being fed intravenously. You're on oxygen. It's like critical care. So that's why most people, 20 days in a skilled nursing facility. Now, there are people that stay longer than that, but typically 20 days is going to be about it, because you're either going to get better and move into a different type of care, or you're going to pass away from whatever's going on with you because it's skilled. And if someone is paying day 21 through 100, that's going to be subject to their maximum out of pocket. If they're paying $194, that's $6,500, they're going to get to that pretty darn quick. The part to remember about this is that after day 100, day 101 and beyond, that's not covered under the maximum out of pocket. It's paid 100% by the patient. It's really considered like long-term care. So very important to know that maximum out of pocket does run out after the 100th day. And emergency room, $90 copay, ambulance, these are little bills that they get, but they're nuisances, right? They're kind of a pain in the rear that to even get a bill for $260 or that outpatient surgery for $225 or $300. These are things you hear them complain about. And whenever I'm sitting with someone, my favorite house to get into, believe it or not, is someone that already has a Medicare Advantage plan, not through me, through another agent, another competitor, because I get to sit down with them fresh and I say, Mrs. Jones, did you know the 3 most costly out-of-pocket expenses you have with your Medicare Advantage plan are, number 1, hospitalization. Did you know you have to pay $350 a day for days 1 through 5? And most of the time, 99% of the time, they don't remember it. You told them when you sold it or when you enrolled them that you have that copay. They don't remember it. It's been too long. They go, no, I didn't know I had that. Yes. Also, recuperation. You know, skilled nursing, after the 20th day, there's a copay of $194. Then after that, you have to pay 100% after day 100. Also, outpatient rehab is typically about $40 every time you go. You go 2 or 3 times a week. That could be $80 to $120 a week that you're spending. And then number 3, big cost. Did you know you have to pay 20% copay on cancer costs? That will get their attention by all means. Because we all know when you say, do you know anyone that's ever had cancer? Typically, everyone's going to raise their hand in the room. Cancer's affected all of us. So these are the 3 things when I'm talking to an individual that I try to fill the gap on. But guess what? If I just fill the gap on hospital, that would be good enough. You can sell a policy reasonably small amount and take care of what they're most likely to use, and that's a daily hospital, which you're going to see. So yes, we're finally to the plan. Aetna's Hospital Indemnity Flex, it is one of the top ones in the market. There's lots of good ones out there, but when you have the Aetna name, it does a lot of things for you. It not only is the coverage great, you don't have to explain who XYZ company is for 20 minutes, and we're all good at that, because they're buying you, and if you're good, they feel the company you're representing is going to be good. But the Aetna really does add to that. So this is issue ages 18 years old to 89. There is no height and weight chart. That's something that Aetna is much different than a lot of carriers. And you're not really going to see a height and weight chart on much of Aetna's plans at all. And it pays in addition to any other coverage, including Medicare, Medicare Advantage, or major medical. So it is a true indemnity. If they have another insurance that pays the bill in full, yes, Aetna Hospital Indemnity will still pay its full amount directly to the insured unless they assign the claims to the hospital or the provider. And please don't forget that Aetna has an e-app that has a special signature. And during COVID and just being remote selling, it's come in very handy. All you need to do is tell the applicant, hey, we're going to sign this with a personal security question, and I'm going to ask you the question, and your answer will be your signature. So what is your mother's maiden name? All they do, give you the mother's maiden name, you type it in, hit enter, it signs everything for the insured. Nothing, not an email has to be sent to the insured. Nothing is bounced back. They don't click a button. They don't have to say okay. They just have to know that you are electronically signing it with that phrase, and that they, of course, want the coverage. And let's see here, premiums. Okay, this is an important part. Renewal premiums do not increase because of an age or health change. You'll never find that. Pays outpatient hospital observation, because we know that's on the rise. And it has a quick view underwriting drug list. So very quickly, all of Aetna's plans have their own drug list. AetnaSeniorProducts.com. You can download the list. It changes once or twice a year, so you want to make sure you have the latest version, but it's always live on the website. And there are companies out there that they don't have a drug list, or at least not one that they give to the agents. They might have one in the underwriting department, and they go, oh, they're on this drug, so it's a reject. Aetna wants you to know, while you're sitting in the house, while you're with that person virtually, whatever it may be, they want you to know if this plan is going to be issued or not. And I want to know if it's going to be issued or not. There's nothing worse than you found the house, you got the lead, you talk to them, you got them on the insurance, everything is good, you leave, and then they get rejected. You don't want that. So let's take that out of it. Use the Quick View underwriting drug list. I promise you it's a tool to help you. It's not to give you more underwriting or to, boy, Aetna's hard. They have that hard underwriting. They don't. They don't. So I'm going to concentrate on this real quick because I think this is big. I got into this business to make money, help people, and make money. So what I do is this. You know, I don't have a 401k that a big company pays for. We got to all open up our own 401ks, right? We don't have a big corporation contributing. So we have to earn our own. So every sale we make, we want that to stay in the home as long as possible, as many years as possible. And guess what? Sometimes people take these policies out. They know they have them. They've never had to use them. And that's what insurance is. They understand that. But why is this important for growing my book of business and creating wealth? Here's why. When that senior has a birthday and just so happens they might be turning 70, says, why is my insurance going up? I've never had to use it. Do I even need this anymore? This is the scenario I never want to happen. A lot of carriers out there, not Aetna, they have those age bands where 65 to 69, it's one price. As soon as they have that 70th birthday, they're going to get a rate increase. And what do? You go, you know what, honey, we've never used this. Do we even need it? And then they drop it. Don't let that happen to you. Sell an Aetna product. It will never change because of a birthday or an illness. The only way they have a rate increase is if they have to go to the Department of Insurance because they're losing money. And Aetna, as you know, is not losing money. So just wanted to throw that in there. So plan benefits works like this. You have option one. This benefit has a lump sum feature. So it will be anywhere from $250 all the way up to $2,500. And as long as they're in there for 24 hours, it can even be an observation, what's going to happen is they're going to get that lump sum benefit. So how often do they get that benefit? Here's how often. So every period of care is 60 days. So if they go in there to the hospital for 24 hours, they're going to get the lump sum. After they get out of the hospital, a 60-day clock starts. Once 60 days has passed, if they go back in, they get another lump sum benefit. And it will continue. There is no limit to the number of times they can go back into the hospital. Just needs to be every 60 days. It's going to reset. Other carriers will, have it down to three times, that type of thing. So option two, This is typically the one that
Hey, Jamie, can you hear me?
up to $700 per day. So it gives you a good hefty amount. And the reason I showed all of those other carriers and how much they charge and how many days is because a lot of carriers out there, they either will offer, you know, odd days or even days. I love that Aetna will offer, you get 3, 4, 5, 6, 7, 8, 9, 10, or 20 days. I like it when I can pinpoint, okay, you have a 5-day copay, a 6-day, a 3-day, a 9-day. I can pick any of those, and it's like a puzzle piece. It fits perfectly. So the benefit above on option 1, yes, you got to be there 24 hours to get a benefit. Well, on option 2, if you're in 24 hours or more, even in observation, you're going to get the full benefit. What about if you stay under 24 hours? Well, Aetna has made it to where at least they're going to get 50% of their daily benefit. So that that $350 a day, you know, $175 they get to go home with, that's much better than getting nothing. And most people are happy that they got something because typically there's not a big copay for staying less than a day. Now, once you have option 1 or option 2, you can add the riders. So daily skilled nursing facility. There's a 3-day hospital stay required. Observation is included. So as long as they're in 3 days, inpatient or outpatient, they can choose anywhere from $10 per day up to $200 per day. Then you can choose how many days of benefit you would like. You can choose 1 through 20, 21 through 100, or 1 through 100. And typically, with a Medicare Advantage plan, to fill that gap, as I just said, like a puzzle piece, the first 20 days are usually a given with Medicare Advantage for now. That could change in the future. But day 21 through 100 would seem like the logical choice. I'm going to show you what I typically do to get more bang for the client's buck there, so to speak. So doctor's visits. There is a doctor visit rider, and it will pay up to 20 visits per calendar year, anywhere from $10 per visit. You can go all the way up to $60 per visit. Also, there is the outpatient surgical rider, and that is also $250 units. You can go up to $1,500, and it's payable one time per calendar year. So January 1st through December 31st. Hospital emergency room visit or ambulance service. Here's another good one. This is very popular on this plan. It pays a flat $200. It will pay twice a year, and it can be for the emergency room or ambulance visit. Another popular one, lump sum cancer. So all of you know about Aetna's cancer, heart attack, stroke, standalone plan. It's amazing and great. Just picture this as a mini one. It's a lump sum benefit. It's not going to pay for heart or stroke. It's strictly cancer, but it can pay $2,500, $5,000, or $10,000 benefit. It is the only rider on here that once you use it one time, it does not restore itself. It's gone. And last but not least, outpatient rehabilitation. This feature is 15 or 30 visits annually, and it pays a flat $50 per visit. And I will tell you, this is a great, great rider. It's very inexpensive. I think for a 65-year-old, 30 visits at $50 a visit, it's like $5 a month. So it's very, very affordable, and it gives you a lot to talk about as an agent. Now, if you added all of these riders, that'd be a darn expensive plan. So that's why I say pick and choose what's best for your client and what they're going to need, what's important to them, and you can't go wrong with that. So here it is at a glance, rates at a glance. I used age 65 to 69, and I used that Aetna template, $250 per day. So here's what it looks like. You can see the monthly premium, $26.16. So that would be $250 a day, 8 days, total payout $2,000, and it would do that every 60 days. It will give them another 8 days. But $26.16. As I said, you could stop right here and just offer this plan to all of your Medicare Advantage folks out there. And they will be tickled pink when they go into a hospital and it's paid. And they did all that for $26.16, and the premium's going to stay level. If you want to add the skilled nursing facility, and this was the little bit I told you, more bang for the buck, it basically this. Most people, unless they're very sick, usually a 20-day stay is about normal, right? So what I thought is this: why not duplicate day 1 through 20, maximize the daily payout at $200 a day, give them the max. If they go into a skilled nursing facility and their Medicare Advantage plan pays the 20 days and they go home, the insured's going to get a check from Aetna for $4,000. That money is theirs to spend as they wish. They're not restricted in any way. They can use it. They don't have to use it for medical. They're not going to be taxed on it. Or let's talk about this. I've already said, typically day 21 in a nursing home, you're going to transfer over to either intermediate care or custodial care, which the rider doesn't pay for. So what this also does, if they stay in more than 20 days in the nursing facility, if I duplicate that first 20 days, they're going to have an extra $4,000 to extend their stay. So that's a big deal because they're paying $11.17 a month for that benefit. And I think they get so much use out of that, it's going to pay. And I like it when an insurance company pays my clients because guess what? They know it's good. They appreciate you, the agent, and they're going to renew that plan year after year. Ambulatory Surgical Center, $250 benefit, costs $13.07 monthly. Emergency room, ambulance, $250 benefit. There you go, $10.17, which a total of $71.56. So the average premium on hospital indemnity that Aetna receives, and this may be helpful for all of you. I know a lot of you out there, $30 premiums typically what you try to get on a hospital indemnity, and you see you can do that on the hospital confinement part. But Aetna gets $65 to $75 per household, per person on a hospital indemnity because of all these riders and filling in the gaps and talking about the changes, talking about the gaps. And you might say, well, that's almost as much as a Medicare supplement. I've sat with many people, and it might be June. They have a different carrier for their Medicare Advantage plan. And I'll say, Mrs. Jones, this is what you need to fill the gap. I said, if you like, if you'd rather have no copays, I can come back in October, put you on a Medicare supplement during open enrollment. You'll pay $110 for your Medicare supplement. You'll pay $20 for your drug plan. That's $130. Or you keep what you have, we'll fill those gaps, and you'll only spend $71.56. And this premium doesn't go up year after year like a Medicare supplement. And they will look at me and they'll go, you know what, I'd rather pay the $71.56. I say, you know what, that's what I would do too. I put them on the plan. Then when open enrollment comes, I'm going to be back in that house. I'm going to put them on my Medicare Advantage plan, and it probably would be an Aetna Medicare Advantage plan. Doesn't have to be paired with the hospital indemnity through Aetna, but that's probably what I would do. Now they have 2 Aetna plans in the house. You will own that house. They will renew year after year after year, and there's your 401k. So, like I said, you don't have to add all these riders. You can just have them spend the 2616. You got the Aetna name with it. They're still going to be happy. You can always add more coverage later if they decide they want it. And just very quickly, let's see, how much time do I have here? I got a few minutes, and I'll throw it back over to Tim. I just want you to see this application might look scary to some of you and go, oh, you know what, I'm going to go with XYZ. They only ask a few questions. And you can, but this is only asking, are you confined to a nursing home? Are you bedridden? In the past 3 years, that's as far back as it goes, have you had a stroke, cancer, Alzheimer's, Parkinson's, AIDS? Most people are going to answer no to that. In the past 2 years, have you had to use oxygen, mechanical oxygen, colostomy? Have you had a TIA, a mini stroke? Have you been hospitalized 3 or more times? If you've been hospitalized twice in the past 2 years, you can still get the plan. Then in the past 12 months, have you had a heart attack, artery disease? Do you use 40 units of insulin or more? Or do you have hepatitis? So 39 units or less, you're good to go. And last but not least, taking 4 or more prescriptions for heart or artery disease. So that means you can take 3 heart pills and still get the plan. And then the only other question is this: if you had cancer in the past 10 years? If it's no, you can get it. This plan was built with the 10-year look back instead of the 5, like our standalone cancer, heart attack, stroke. If they have had cancer in the past 10 years but over 5, just give them the cancer plan, standalone cancer plan, and you can give them all these other benefits, because cancer on this is only a 36-month look back to get the hospital benefits and all the other riders except the cancer. So just remember, available age is 18 to 89. Pre-existing condition is covered after 90 days. All benefits are paid in addition to any other insurance coverage, including Medicare, anything else. Premiums do not increase because of age or health changes, no height and weight chart, and guaranteed renewable for life. So all those important features. And again, I will close it there. Just remember this. I'm going to pop out for just a second here. I want you to see one more thing. Skip through that so you can see. Don't forget about the Aetna mobile rate app. It's called Quotes on the Go. When you go to your app store, it doesn't matter if it's Apple or Google, Android, and just put in Quotes on the Go. You don't have to put in Aetna. Quotes on the Go. You can start quoting, just playing around with the different prices, and it's so easy. There's no agent login. Anybody can use this. We want you to be appointed, of course, because we want you to sell it, but even if someone's not appointed, they can use this app. So, and don't forget, Aetna has been around since 1853. They actually paid the very first Medicare benefit. So that's good to know. You got the history of Aetna with you when you're out there representing their product. So thank you all for listening to that. And I don't know if there's any questions, Tim, but I'm happy to answer some if we're doing that.
Sure, that would be great, Jamie. Awesome. Always enjoy listening to you. You put everything into perspective, and it really makes sense. We did have one question out here. Can the client change their benefits once enrolled? Would it require a new app?
It would require a new app. You can take away benefits and keep your same enrollment, your first app. You could, get some of the riders omitted, but no, you could not add. You would have to have a whole new application and go through underwriting again. Great question.
All right, perfect. I don't see any other questions, and appreciate everyone attending. What I'd like to do is kind of show you some tools to make this even easier to show your client when you're talking to them. So I'm going to share my screen here, Jamie. So everyone has access to this tool already. So if you are a Cornerstone agent and you have at least one carrier with us, you have this tool already. If you're not familiar with it, we'll go through. I'm just going to show you briefly how to use the hospital indemnity. It's more like an illustration tool, but as Jamie mentioned, talking about how Medicare Advantage is continuing to grow, we are seeing just our agents in general. We're seeing less med sup sales, more MA sales. And I'll use this as a real life example because I have an agent friend, and this client is a friend of mine as well, who was on a Medicare supplement plan F, and he was paying over $300 a month, and he wanted to go to a Medicare Advantage plan. He switched over to a Medicare Advantage plan, and then it wasn't, maybe 6 months after that, he was hospitalized. And he got hit with just what Jamie had mentioned, that big hospital copay. He had never had to pay copays before. And had this been discussed with the client, he would have definitely, picked this up and had this, because now he has set up a payment plan. If you remember that slide Jamie showed, where it showed that you had this bill from going to the hospital, and then at the bottom it had a payment option for 2 years, or you could just pay the lump sum. So he is currently paying a monthly payment back to the hospital because he didn't have that money sitting in the savings account for him to make that co-payment payment. So I think the real question behind it is just ask your question. Just make sure you're asking the question to your client. So what I'm going to show you here real quick is on our Medicare Center platform. If you're not set up with it, feel free to reach out to myself and we can get you set up where you can register for it. But this has all the different quoting engines all in one place. And what you're going to do is we'll just simply log in here. Once you're set up, it's going to be your NPN number and a password. Click login. And through this tool, you can quote your Medicare Advantage plans either through a Connector platform or Sunfire platform. But we also have this tool called CSG app. And I love this tool because it actually helps you sell and illustrate and show your clients exactly how to fill in those gaps. So I'm going to just click on the CSG application. Bear with me 1 second here, it's spinning. Okay, and with the CSG tool, there's a lot of tools that you can use, and I'm happy to go through any of these tools at a later time with you. But 2 ways to quote hospital indemnity. One is just strictly going to the run quote hospital indemnity, which is great. You can quote any carrier you want out there. I'm a big fan of the Aetna hospital indemnity because it makes sense, and as Jamie mentioned, you can totally customize your hospital indemnity plan to meet specifically what your Medicare Advantage copays will be. Best way to do this, though, is to go under Medicare Advantage version 2. It'll say new up here. Click on run quote. You can put in a client name if you want. You can also print this off, and it will have the client's name on there. It's as simple as putting your zip code in. I'm going to use a Central Ohio zip code here. It's going to default to Medicare Advantage, plan year 2022. It's going to sort by least expensive to most expensive. And then if they qualify for low income subsidy, you can put that in there as well. Just because I'm running a hospital indemnity, I can put for Medicare Advantage, I can put in prescription drugs here and things like that if I want. But for the sake of this example, I'm just going to turn that piece of it off. It works the same as Medicare.gov in the sense that you can put in your prescription drugs and things like that. But what I want to do is, if I already know a plan that I've already sold my client, or client already has or even if this is the plan I'm presenting, as I'm going through the benefits, and I'll use the Aetna HMO point of service plan, what I can do is see a total overview. And as I'm going through the benefits here, like through the benefits and costs, you literally could, when you're going through, and we look at a hospital, find it here. Well, we can just start at the top here where it says ambulance. It says $260 copay. If you just ask the question as you're going through your summary of benefits with your client, and just ask them, hey, I have a way I can show you to how we can reduce or eliminate this copay. Would this be something of interest to you? If you just ask that simple question to them each time you go through some of these bigger copays, you're going to get them to say yes. And as they say yes, once you're done completing your Medicare Advantage sale, then all you have to do is turn it and say, now that we've got your Medicare Advantage plan in place, now let's talk about how how we can reduce or eliminate those copays. And all you have to do is you pull your plan up, which we have here, the Aetna Medicare. We're going to click on fill in the gaps. And it's as simple as you're putting in the zip code, which is going to default to the zip code for the Medicare Advantage, add the gender, male or female, the age, tobacco or non-tobacco, and then we're going to click search quotes. Now with this tool, I mentioned it's going to show you every hospital indemnity plan within, within this area. But I'm going to go to the Aetna again because it's one of my my favorite plans. It's easy to sell, and it's just for all the reasons that Jamie had mentioned as well. He mentioned there were two different plans. There's a lump sum, which here, this Protection Series lump sum benefit, it starts with a $250 per occurrence. So if you're hospitalized, you would get $250. You can go and you can change that amount, but you can see the base premium is $9.08. I want to go to the other one, the Flex Series, because it is more customizable specifically to the Medicare Advantage plan. So here it is, $16.67 a month, Protection Series Flex Daily. And this one's going to pay $250 a day for 3 days. All we're going to do is we're going to just add this to the comparison. And now you will see your benefits with your Medicare Advantage plan on the left side. And then on the right side, you're going to see how you can fill in those gaps here. So the base premium, again, is $16.67. First big copay we're going to take a look at is the inpatient hospital. And for this plan, it's $350 a day for days 1 through 5. And then there's no copay days 6 through 90. So all you can do, I mean, you can sell them the simple $250 a day, and they would just pay the additional $100 for days 1 through 3, and then they would pay the $350 a day for 4 or 5. Or you could use this drop down, and you can go specifically to the $350 a day, and you can see all the different options here. But what we want to do is mirror what their copays are going to be. So we're going to check on the $350 a day, days 1 through 5. Now our base premium is $28.87. And as Jamie mentioned, you're fine right there. That's going to be one of the larger copays that an individual would face with a Medicare Advantage. But you can also talk about some of the other benefits, or ways you could fill in the gaps as well. So for outpatient hospital, depending on the what's being done, it's a copays anywhere between 0 to 295 days, or $295 copay per visit. You can add a benefit in here, and $250 pays per surgical procedure. You'll also see next to that in parentheses, this is the additional premium it adds to it. So if we elected the $250 per surgical procedure, that's going to add to the overall, and you can see the total cost, how that increases. Skilled nursing, again, 3 different options here. As Jamie mentioned, days 1 through 20, it's a 0 copay. You can select an option where it would pay them for the first, days 1 through 20, and you can see in there what that would run for that. If you want to truly fill in the gaps, you can also look at days 21 through 100, and days 21 through 100, it's $188 copay. And so you can simply go to, let's just say we're going to go $190 a day here. So days 21 through 100, now they're going to receive $190 a day from Aetna, and you can see the overall premium where it changes there. But you can see in parentheses exactly what that would cost. If somebody wants a benefit for days, completely for days 1 through 100, you can select that as well. So again, it's really, if you're looking to truly fill in the gaps, just mirror the images, mirror the coverages for the MA plans. Same with rehab services. With Aetna plan, $40 copay for occupational therapy or physical therapy. Their benefits, a 15-day for $50 or $50 for 30 days. And you can see the premiums there. And you just can go through line by line and just fill it in. And if it's not available with that, with the plan, it'll say it's not available. Now with emergency care, this is also going to include the ambulance benefit as well. And literally you would just go down and it would be $200 per occurrence. This would cover you for if you were had to use an ambulance or if you went into the emergency room. So you can see it'll pay a little bit more than what your copay is here, but it will also, if it's using an ambulance, it's going to be a $260 copay versus $200 you're going to receive. So as you can see, as you go through there, you can really just fill in the gaps. It's a great visual for your clients. And let me tell you this, I hear it from a lot of agents out there, and these are agents across the country where a lot of times that's how these agents are getting in the door, because agents are not talking about this benefit. And whether they have a med stuff before and they weren't paying any copays, it was like a Plan F, or they're paying a Part B deductible through a Plan G, and they're moving to a Medicare Advantage. There are gaps in there. So just by asking a simple question, I can show you a way to reduce or eliminate this this copay. Would you be interested? And of course they're going to be interested. They want to hear what you have to say, but you have that buy-in, which makes that easy transition over to selling a hospital indemnity plan. Any questions on anything that we went over? It is 11 o'clock, and I want to be cognizant of your time. This was scheduled for 1 hour. If there are no questions, if you do want to learn more about the Medicare Center quoting and enrollment tool, feel free to reach out to myself here, or you can reach out to Matt Fry here in our office as well, and we can get you set up with this great tool. I want to thank Jamie for his time, for doing the presentation. Always enjoy listening to your presentation, Jamie. You do a great job, and it puts everything into perspective as well. So,
thank you, Tim. Thanks, everyone. Tim, that was awesome. I loved what you did there.
So thanks, Jamie. Well, thank you, everyone. Always enjoy having you on there. We will record this, so it will be out on our website. If you want to go back and listen to it again, it'll be out there in just a little bit. Looks like we do have one question here. You have a client presentation available.
Tim, I can send you a PDF of what I just showed. Now, it wouldn't be interactive and moving, but I can send it. It's a very large file, and then you guys can do, if you want to give it out, you're welcome to. It's really up to you all.
Okay. Yeah, we can get that
Yep.
out to everyone. If you want to use the interactive tool like I showed you, and that's simply through MedicareCenter.com. And if if you need help or you need to get set up with that, just reach out to myself, and happy to get you set up with that. All right, with that, thank you all for attending. We sincerely appreciate it as well. Jamie, as always, thank you very much, and everyone have a great day. Thank you.
Thank you. Bye-bye.